Now, I suppose it's the fate of government that problems pile up in front of them, often not of their own making. There is no denying that one issue which has the potential to create second-class citizens is healthcare. We've got a wonderful public hospital system, though I have to say there are profound weaknesses. An inquest has begun today into the appalling story concerning the death of an 18-year-old from Broken Hill, Alex Braze. It appears there is more than something wrong with the system there. This is tragic beyond definition. 18-year-old Alex presented 4 times to the Broken Hill Hospital's emergency department before anything happened. There's an inquest beginning today. The young man allegedly died from an infected toenail. There'll be all sorts of talk about what kind of procedures are or are not in place, but since Alex died, 10 of the 18 senior doctors working at Broken Hill have left. Almost all of them have cited poor clinical governance. But this surely is the epitome of systemic failure, a tragic death of an 18-year-old whose family are surely entitled to expect better. But Broken Hill Hospital isn't alone. Many families believe that their best option in healthcare is to take out private health insurance. But health fund premiums have gone up by 15.5% this month alone. Have you checked? Many of the top insurance products cost up to $800 a month. Now, anything at $800 a month for private healthcare is unaffordable. And how the hell do you know what you're getting? There are 104,000 health fund policies, a massive disparity in premiums. And if you're single and earning over $90,000 or a family on over $180,000, you have to have insurance or pay a higher Medicare levy. Now, someone's going to have to address this healthcare quagmire. People take out car insurance. Obviously, there's an excess, which we accept, but then the insurance covers everything, the full cost of repair. In health insurance, as opposed to car insurance, not one product covers all costs. We pay 4 times for healthcare. We pay tax, which is meant to fund the nation's healthcare. We also pay Medicare levy. Then we pay private health insurance premiums. Then we pay the gap. If you go to hospital, the best policies will cover the cost of your accommodation, but not the cost of the surgeon or the anaesthetist. The gap sometimes is enormous. And the fewer people in private health insurance, the higher the premiums, because technology is enabling people to have the most complicated procedures. This is a dog chasing its tail. The sad reality is health insurance covers so little of your healthcare costs. But if people abandon private health insurance and choose the free public system, unless you're in an emergency like having a baby or involved in an accident or diagnosed with cancer, you could be waiting forever. Now, politicians will promise to change all this in order to win votes. Don't believe them. What we have is a product of politicians already meddling with the system to the point that it's unaffordable. Now, once upon a time, everyone had private health insurance and the premiums were tax deductible. Simple. It'd be cheaper than the bureaucratic, unintelligible and exorbitantly expensive system we now have. Sadly, too many people, like young Alex at Broken Hill, tragically fall through the cracks.